Hi guys, my name is Sachi Khemka. I'm a third year medical student at Texas Tech Health Sciences Center, and today I'm going to be talking about the role of diet and exercise in aging and Alzheimer's disease as part of this webinar series with Dr. Reddy's lab. This article was actually published in the Aging Research Reviews in 2023, so today I'm just going to be covering a lot of the high points and key takeaways of that article. So I'm going to first be talking about Alzheimer's disease, then I'm going to jump into some statistics with the disease burden, talking about different types of diets, the link between diet and aging, as well as diet and Alzheimer's disease, as well as exercise and its intersection with Alzheimer's, and then some current medications that are being used to treat Alzheimer's, and then future directions as far as research goes in this area. So what is Alzheimer's disease? As we know, it's a progressive neurodegenerative disease that occurs in our brains and our bodies. One of the mechanisms for this degeneration is the hyperphosphorylation of the tau protein, which can lead to the degeneration of microtubules and the formation of what we call neurofibrillary tangles. Another mechanism is the accumulation of beta amyloid plaques, and those are formed by improper cleavage of the amyloid precursor protein, and then we end up getting aggregation and accumulation of these plaques, and it interferes with neuronal signaling. So clinical manifestations of all of these pathological processes can lead to memory loss and multiple cognitive impairments. Both genetic and environmental factors contribute to the development of Alzheimer's, and that can include the ApoE4 genotype, as well as traumatic brain injury, diabetes, obesity, hypertension, cardiovascular disease, as well as an unhealthy lifestyle. So things we can control, like an unhealthy diet and a lack of exercise, that can also contribute to Alzheimer's. So I'm going to talk about the disease burden. Unfortunately, it is quite severe and affects a lot of people in the US, but also worldwide. So it affects over 60 million people worldwide and then 6.7 million people in the US as of 2023. It's a statistic given by the World Health Organization. And then Alzheimer's not only affects the patient, but it also affects the family unit or the caregiver caring for the patient. So over 11 million caregivers provide unpaid care for individuals with Alzheimer's or other dementias. And then in 2022, caregivers devoted 18 billion hours of unpaid care, valued at about $339.5 billion. We also see that Alzheimer's disproportionately affects certain populations over others. So 60% of dementia cases occur in low and middle income countries. And then low socioeconomic status, which is more commonly associated among African Americans and Hispanic population, is linked to a higher risk of dementia and cognitive dysfunction. So we can see that burden is kind of disproportionate among different types of people. So now I'm going to be covering some different types of diets. And so this figure was actually in the paper that I mentioned before, and it kind of summarizes different diets and its effect on chronic disease processes as well as Alzheimer's. So I'm just going to quickly go over it. So we have our high-fat diet, which is kind of like this donut you see right here. It's basically foods that are heavily fried, high in fat content, fatty meats, oils. Our Western diet is what we commonly think of fast food. So we have foods that are high in fatty content and sucrose. And then our Mediterranean diet is one that is high in fruits, vegetables, whole grains, nuts, and lean meats. And then vegan diet, as we know, no consumption of dairy products or animal products. High in fruit, vegetables, grains, and nuts. And then our ketogenic diet is our low carb, high fat diet. And then our high carb diet is pretty self-explanatory with a lot of carbs and grains. And so our high carb, we'll actually start with our high fat diet and Western diet are associated with a lot of oxidative stress and a lot of inflammation, and that can lead to the development of Alzheimer's. And also been linked with an increased risk of diabetes and an increased risk of cardiovascular disease as well as obesity. Our Mediterranean diets and vegan diets, however, have a lot of anti-inflammatory properties, so they are linked to lower risk of chronic disease, improved insulin sensitivity, lower obesity rates, and then positive effects on cardiovascular health. And then our ketogenic diet has shown some promise in the reduction of the amyloid beta plaque levels, proteins, and then improved glycemic control and weight loss, and then the potential to lower cardiovascular disease risk. And then our high carb diet hasn't been studied as extensively, but it has been associated with Alzheimer's disease pathogenesis and then potentially increased risk for cardiovascular disease. So what do we know about aging? Aging alters our metabolism. It leads to a lot of hormonal shifts in growth hormone, insulin growth factor 1, sex hormones that can impact our muscle mass. So as we age, our muscle mass does decrease along with our cognitive function, our bone density, our fat content. And so aging can contribute to different chronic disease processes, like hypertension, cardiovascular disease, obesity, diabetes, and things as such. It can also contribute to osteoporosis, sarcopenia, cognitive decline. We also have dysregulation of a lot of our metabolic processes like glycolysis, oxidative phosphorylation, and fat metabolism. And that has been linked to the development of chronic diseases as well as neurodegenerative disorders. And then we have outward changes as well. So our skin ages, we get thinning, reduced elasticity, wrinkles. So all of these changes that occur in our body and our brains and our cognitive function can be summarized by the free radical theory of aging, which highlights that oxidative damage, telomere shortening, and mitochondrial dysfunction are key drivers of aging and disease progression. So as I mentioned, the different diets that I outlined before do have different effects on aging. So I'm just going to kind of summarize some of those effects. These different studies are mentioned in that paper that I mentioned as well, but I'm going to kind of cover the more relevant and more promising and more robust studies here. So the high-fat diet has been linked to accelerating the aging process and causing joint deterioration and microglial dysfunction. It also impairs immune function and cognitive task ability. And then our Mediterranean diet and vegan diets have been shown to promote a longer lifespan. The Mediterranean diet specifically has been shown to preserve muscle mass, has been shown to have a higher bone mineral density, reduce cognitive decline, and improved immune function, also preventing skeletal mass loss and supporting immune function by also supporting our gut microbiota. Same with the vegetarian and vegan diet has very similar findings, a lot of anti-inflammatory properties. However, one of the concerns that is brought up in a lot of papers and a lot of literature is that there is insufficient protein intake. So as I mentioned before, as we age, our muscle mass does decline. So this can further exacerbate that issue, in addition to the fact that we do have sometimes like vitamin B12 and vitamin D deficiencies with vegan diets and vegetarian diets as well. So our ketogenic diet has been shown to extend lifespan and preserve muscle mass by reducing oxidative stress and improving mitochondrial function. And then our high carbohydrate diet, as I mentioned before, hasn't been studied quite extensively, but it can and potentially may have shown to extend lifespan by reducing our insulin growth factor 1 levels and oxidative stress. And so this figure kind of just summarizes exactly what I was talking about. Our Mediterranean diet and vegan diets have shown to enhance our lifespan, improve inflammatory processes, and decrease the number of inflammatory biomarkers, decrease the risk of development of dementia and Alzheimer's, boosting our immune response. And then this is in contrast to the high-fat diet, which has almost always been associated with accelerating this aging process and then worsening the effects of aging on the morphology of microglia and the amygdala. Right, so now I'm going to talk about the relationship between diet and Alzheimer's disease. So we have our high-fat Western diet. A lot of these studies that are referenced in these paper in this talk were done in animals. One of the key studies found that short-term high-fat diet led to increased oxidative stress, protein oxidation, and lipid peroxidation, which can contribute to the progression and pathogenesis of Alzheimer's. However, another study showed that timing is actually crucial. So high-fat diet that's introduced early in life, so before 3 months, has neuroprotective effects, reducing the deposition of that amyloid beta proteins and plaques, and therefore curbing cognitive dysfunction. So I found this to be quite interesting. As we know, high-fat diet does have a very significant and proven correlation with aging, but with Alzheimer's, it seems to be there's kind of a lot of controversial evidence. Maybe it can increase oxidative stress, but maybe if it's introduced earlier, it's something that our body adapts to, and therefore it can be neuroprotective. So that's kind of an interesting finding. Obviously, more research needs to be done in this area. Our Mediterranean diet, as I mentioned before, rich in a lot of those nuts, fat, healthy fats, olive oil has been shown to improve cognitive function, such as memory, attention, and global cognition. And the anti-inflammatory properties of the Mediterranean diet may contribute to its protective effects against Alzheimer's. What I found from kind of my literature review and all of my search and kind of what I said in my paper is this diet seems to have the most consensus again, for protecting against the development of Alzheimer's. However, as I mentioned in this slide here, not all studies have consistently shown these benefits. So that's also something that's quite interesting. The vegan diet, very similar to the Mediterranean diet, has shown promise with slowing Alzheimer's disease progression, and it's known for its anti-inflammatory effects. So now I'm going to be talking about exercise. As we know, exercise has a lot of benefits on our bodies. It can prevent the development of chronic illnesses, and then regular exercise promotes our well-being, vitality, and autonomy, especially as we age. Benefits of regular exercise are definitely robust as well. They alleviate stress and anxiety, improve mood, boost our cognitive function, and enhance our memory. They also strengthen our muscles and bones. We also see the reduction of different chronic diseases such as heart disease, strokes, cognitive dysfunction, obesity, diabetes, and then cancer. So there has been a lot of studies, both human and animal studies, that have shown links between positive effects of exercise on Alzheimer's disease. I specifically studied 3 different kind of subcategories of exercise: aerobic exercise, walking, because there's been a lot of research on walking specifically, and then strength training and balance, so a lot of weightlifting. So aerobic exercise has been shown to increase hippocampal volume, which improves memory function, and this should make sense as we know that the hippocampus plays a great role in our memory and storage of memory as well. And then walking also has positive cognitive impacts in late stage Alzheimer's. There's been controversial information on whether walking is helpful for early stage Alzheimer's, but this study did show that it had a positive impact on cognition with patients with late stage Alzheimer's. And then strength training and balance, so that can improve mobility and reduce fall risk, which is very important in the morbidity and mortality of patients that are already diagnosed with Alzheimer's. This can be really beneficial for patients who already have Alzheimer's. These are some studies listed at the end of this slide here that I found to be quite interesting. They're predominantly studies done in animal models, but they can still be kind of relevant for humans as well. But they showed that swimming and treadmill exercise show neuroprotective effects. They reduce oxidative damage and prevent cognitive dysfunction. And then we see that long-term exercise enhances neuronal density and protects against the formation of amyloid beta plaques. And then voluntary exercise promotes neuroplasticity and reduces plaque load compared to forced exercise. So kind of integrating that mental component of exercise and well-being, which I thought was very interesting. So there's definitely kind of a component of our cognition and our memory and our willingness to do exercise that plays in the development of Alzheimer's as well. So there are different medications that can be used to treat Alzheimer's. Most of them are symptomatic control, but some of them have shown promise in modifying the disease progression of Alzheimer's, which has been very interesting and promising. So we have cholinergic agonists, we have donepezil, rivastigmine, galantamine, tacrine. These all inhibit acetylcholine esterase. And then we have antioxidants. So we know vitamin E found in our berries, protecting against oxidative stress. Interestingly, estrogen, which reduces neuronal generation of Alzheimer's beta amyloid peptides. Our NMDA receptor antagonist, so memantine is a popular one that reduces neurotoxicity. And then combination therapy. So this has been used for quite a while, but more recently there have been some studies that have shown its ability to kind of modify disease progression which has been very promising in this field. So combination of memantine and donepezil have synergistic effects that can manage symptoms and then potentially also kind of alter the progression of the disease as well. So future directions of research in this area, kind of delving more into the genetic and molecular insights of the disease itself, comprehensive lifestyle modification programs, so integrating both diet and exercise into an individualized kind of plan for patients that are diagnosed with Alzheimer's or those that are at increased risk, nutritional therapies, targeting brain health and metabolic function, and then digital health tools for monitoring and adherence. It's one thing to, have a plan, but also following through with that plan can be very tricky. And so health tools that kind of keep you on track with following through with a diet or following through with an exercise plan have definitely needs to be researched more. Combination therapy, so again, that lifestyle plus medication intervention. So kind of setting the difference between diet and exercise plans alone, and then diet, exercise, and pharmacology kind of interventions together. So maybe comparing and contrasting things like that and understanding the relationship and its effects on Alzheimer's disease progression. And then longitudinal studies to assess long-term interventions. So long-term exercise, being on the Mediterranean diet for 10 years versus one are all kind of areas of future research. Emerging research areas include neuroprotection, microbiome modulation, and then culturally sensitive global health approaches. And then these are my references used for the presentation. As I mentioned before, my paper has a lot of different studies that are kind of talked about in more detail as opposed to this presentation. But I appreciate y'all's time. Thank you. And feel free to email any questions to me at the email below.